you've argued in that same essay, you say that the crucial factor for why Asia is doing better or has done better with the pandemic is what you refer to as strengths in the capacity of institutions in government and society in managing the public health crisis. Can you just say a little bit about those factors, these capacities in institutions?
Yeah, I mean, you have to start with the fact that they had no resources in terms of technological expertise or financial resources, except for the high-income countries like Singapore, Japan, Korea. But Mongolia, Bhutan, Laos really did not. And the public health knowledge, I mean, sort of, this is not rocket science. They've been societies have been dealing with infectious diseases for centuries, right? And so there's a lot of knowledge in public health about how to contain infectious diseases. And with these infectious diseases that affect your lungs and so forth, like flu and things like coronavirus, that you have to wear masks. But really, the first line of defense is closing your borders from this thing coming into your country, and then identifying, testing, isolating the cases that you find. So tracing. So it's really testing, tracing, isolating. And of course, you have to treat the people who are ill with ventilators and so forth. But this is the point about this virus. This is a new virus, and it's not. Therefore, there are no treatments that are known to be effective, right? I mean, there are all kinds of ways that you deal with it, but nothing special that was developed back in April or March, and there are no vaccines. So without a vaccine, without treatment, your first line of defense is that tracing and isolating, which is all administrative. It's that administrative capacity. And the second thing, is that it goes beyond that, those sort of technical interventions, if you like, is that you have to have leadership that is capable of making quick decisions, and all these countries made these quick decisions, and that has the capacity to work with private sector, work with different ministries of the government, and when I traveled to Japan in October, and I felt like, oh, the Ministry of Health has taken over the airport. So it wasn't like Ministry of Foreign Affairs and Immigration Services, etc. Before you got to passport control, you had to go through a quarantine check. So that kind of thing requires this sort of an administrative coordination, and I think that leadership to take quick action, to coordinate amongst different actors in society. And then there is the communication part of it with society. And I think this is not just unique to the Asian countries. It's something that's noted, for example, in New Zealand. And I think one of the most interesting thing is the experience of the African countries. African countries also have had very low incidence, and people in places like Rwanda and Senegal have been speaking up to say, we've done a very important job of actually taking action early on to stem the spread. Much earlier than in the Western European countries, in the United States, Canada, etc.
So yeah, that's all extremely fascinating, and I think one element of it that I'd like to explore is the question of what makes it effective administration. So when I think of the South African experience, when the pandemic first emerged here, there was actually quite decisive leadership in the early stages. So a ministerial advisory committee was put together, the borders were shut immediately. There was a lot of engagement with different levels of society towards figuring out a consensus-based approach, but one that was also about taking decisive leadership. But when you think about the coming months, just how South Africa's poor state administration started to become exposed when it came to the question of trying to coordinate large bodies of people to act in a certain way. And then a criticism that is often made against some of these countries that have been able to coordinate large groups of people to act in a certain way is that there's always a tendency towards authoritarianisms, the sort of lazy critique that's made. But I guess the question is, how do we distinguish capable administration without it sort of crossing over to authoritarianism? Then, I mean, when we think of an article you wrote, for example, very recently about the experience in Japan, a country where the government really didn't do much, but citizens were still ready and able and willing to take this thing on and to act in the expected ways.
And just to add on to that, I think right at the beginning, when it seemed China was keeping numbers down, there was a lot of articles in the West that sort of said, so does authoritarianism work better when you have a pandemic? Like a lot of that sort of debate came out of it. If you maybe can unpack some of that,
Yeah. So I think that one aspect of this is simply kind of public health technicalities. So what I have noticed is that this business of contact tracing and isolating is really strategic in keeping in really focusing on containing the spread. So we think of things like the lockdown and wearing masks as something as sort of like a generalized, universal, diktat that you must stay at home and, you must wear a mask, you must wash your hands. I mean, it's for everybody. But then there is a much less well-publicized and much less well-known issue of method of basically contact tracing, which if you do it properly, can actually at the very early stages keep on kind of stamping out the new cases from spreading, right? And so this is something that I think these countries did a lot more of. You hardly hear anything about it. So, recently there was a very funny interview with Jeremy Hunt, the UK Secretary of Health from 2012 to 2018, when he admitted that they just made a mistake. He said, we did exhaustive pandemic preparations. We were lauded by Johns Hopkins University as being a second best prepared country in the world. But we were also part of a group think that said that the primary way to respond to a pandemic is the flu pandemic playbook, with a focus on areas like vaccination and boosting hospital capacity, rather than the methods you would use for SARS and MERS: surveillance, containment, community testing, contact tracing and isolation, and stockpiling personal protective equipment and ventilators. So, I mean, this element of contact tracing is really important to sort of stop it at the beginning, right? And then isolating. So I think in many of these countries in Asia, they invested a lot. Certainly in Japan, it was the main kind of investment. And once you were, identified as potentially having been exposed or being the source of the spread, then you were obliged to isolate. And I think that may also, require some coercion, because, you have to be isolated, and you are actually supported in that isolation, in that you are not necessarily just asked, oh, just stay at home. You're actually either asked to or invited to, or you have the option of quarantining in a different place, because a lot of people can't isolate at home if you live with other people, quite frankly. And I don't think it necessarily has to be coercive. So I don't really know. I mean, I think this is something that would be really interesting to explore. So I think there is a simple kind of a judgment call about the importance of contact tracing. And I think in the many countries, contact tracing is just considered to be like just this mobile app, and whereas in fact the technology is used, and it's then technology is also accused of infringing on your privacy and all of that. But then the basic contact tracing is manual. I mean, like in Japan, it's manual contact tracing. But then why is it that in the UK, for example, they know how to do contact tracing? They have a history of public health infrastructure that knows about contact tracing and infectious diseases. But once somebody offered them an app, they jump at it and say, oh, that's what we're going to do to solve the problem of contact tracing. So there wasn't that kind of a serious commitment to contact tracing and isolation, I think, as existed in these Asian countries. And then, can I address this thing about authoritarian, because it's really interesting. I think related to that is the fact that we have the Wuhan model, right? That we think that Wuhan was all about lockdown, ferocious lockdown. And if you are found walking outside, you're instantly fined or whatever, or worse, who knows? But I heard people in Barcelona talking about being told by some, military or police, where are you going, young lady, kind of stuff, So, or even neighbors saying that. But people are saying, is lockdown really the way to control the pandemic, right? Because it's kind of a generalized lockdown. It's first totally impossible to implement in any sort of a humane way. And, these countries of Asia didn't have lockdowns. They didn't all have lockdowns in the style of Wuhan. Certainly Japan never had a lockdown because the country has such a weak government in terms of state power that there is no government authority to impose a harsh lockdown.